Basic anatomy. Challenges in anatomy study. The complexity of the human body with individual variations. Difficulty in understanding the relationship between structure and function. Integration of anatomy with other disciplines such as physiology, pathology, and pharmacology. The study of anatomy is a very important foundation in medical education and other health sciences. But the learning process is not free from challenges. Challenges in the study of anatomy are not only related to the complexity of the very detailed human body structure, but also to the development of technology, teaching methods, and limited resources. Here are some of the main challenges in studying anatomy in more detail. 1. Complexity of human body structure. The human body consists of various organs and systems that are very complex and interconnected. Mastering anatomy means studying very detailed structures and understanding how these parts work together. A. Number and diversity of structures. Description. There are thousands of structures in the human body, ranging from large organs such as the brain, heart, liver, to the smallest tissues and cells. Each body system, such as the nervous, musculoskeletal, cardiovascular, and digestive systems, has many parts with different functions. Challenges. Students must memorize, understand, and relate a lot of information, which can be very confusing and time-consuming. Additionally, each individual has slight anatomical variations, which adds to the complexity. B. Relationships between structures. Description. Not only must one memorize the body parts, but one must also understand how these structures relate to each other in a functional context. Challenges. Understanding the three-dimensional relationships between the various body structures, such as how muscles, blood vessels, and nerves work together, can be a very difficult task. This understanding is especially important for clinical applications, such as when performing surgery or diagnostic procedures. 2. Dissection techniques and practical learning. Although human and animal dissection is a traditional method of studying anatomy, dissection has several challenges, both in terms of ethics, accessibility, and expertise. A. Access to cadaver sources. Description. Cadaver dissection is one of the important methods for understanding human anatomy directly. Challenges. Not all institutions have access to cadavers, and cadaver sources are limited in some countries. In addition, cadavers can be expensive and the preparation process requires special permits and logistical limitations. In addition, ethical and legal issues often arise regarding the use of human bodies for education. B. Dissection skills. Description. Dissection requires specialized skills to carefully manipulate and study the organs and structures of the human body. Challenges. For many students, dissection skills are difficult to master. They need to understand anatomy in detail, while also paying attention to proper technique to avoid damaging the body structures being studied. 3. Use of technology in anatomy learning. The advancement of technology in anatomy education offers a variety of benefits, but also poses challenges related to the adoption and integration of new technologies into the curriculum. A. Challenges of medical imaging technology. Description: modern medical imaging, such as MRI, CT scans, and ultrasound, provide highly detailed images of the human body without the need for dissection. Challenges: although medical imaging provides advantages in visualization, medical students and professionals must learn how to read and interpret these images correctly. Medical imaging does not always replace the direct dissection experience. Due to the difficulty in depicting spatial and three-dimensional relationships between body structures. B. Difficulties in using 3D models and digital simulations. Description: technologies such as 3D models and digital simulations offer an alternative way to learn anatomy without the need to perform dissections or view medical imaging. VR/AR platforms allow for a more immersive learning experience. Challenges: while engaging and interactive, the use of this technology requires access to expensive hardware, and not all educational institutions have the resources to implement it. Furthermore, this technology cannot completely replace hands-on learning on real cadavers or human anatomy. 4. Complex presentation. Anatomy is a highly detailed and technical science, requiring a deep understanding of multiple disciplines. Delivering this material to students often poses several challenges. A. Lack of interactive learning. Description: anatomy is not only about memorizing body structures, but also about understanding the function and relationships between structures. Challenges: many anatomy learning methods are more passive, such as reading books or attending lectures. Active and interactive learning is more effective, but is often difficult to implement in a dense medical education curriculum. B. Inadequate teaching methods. Description: some institutions may not have adequate facilities, such as anatomy laboratories or access to sophisticated technological devices. Challenges: this limits the quality of anatomy teaching, because without direct experience, students may have difficulty understanding anatomy in depth. Anatomy learning often focuses only on memorization and does not include a deeper functional understanding of how structures interact within the body. 5. Time and curriculum limitations of medical education. Medical education generally has a very dense curriculum, with many disciplines to be learned in a short time. A. High curriculum load. Description: medical students must study human anatomy in a limited time, which often clashes with other medical disciplines, such as physiology, biochemistry, and pharmacology. Challenges. With a high load and limited time, many students find it difficult to fully understand anatomy, especially when the curriculum requires them to study many topics in a limited time. B. Difficulty in applying anatomy in clinical practice. Description. After studying anatomy in theory, the next challenge is how to apply this knowledge in real clinical situations, such as diagnosis, surgery, or medical procedures. Challenge. Although students study anatomy in depth, they often find it difficult to translate this knowledge into a clinical context, especially due to the complexity of patients and unexpected medical conditions. 6. Anatomical knowledge update. Anatomy is a constantly evolving discipline, with new research often revealing more detailed and better knowledge about the human body. A. Rapid research progress. Description. Scientific research in the field of anatomy continues to grow, with new discoveries about body structures and how they work. Challenge. Keeping up with the latest developments in anatomy and aligning them with existing materials in the curriculum can be a major challenge. New information often requires updates to textbooks, course materials, and teaching methods, which takes time and resources. Conclusion. The study of anatomy has significant challenges, both in terms of the complexity of the material, limited resources, the learning methods used, and the application of anatomical knowledge in clinical practice. However, with the advancement of technology and innovation in medical education, many of these challenges are beginning to be overcome. Nevertheless, it is important for educators and students to continue to adapt to developments in science and technology in order to better understand human anatomy.